This is gonna blow your mind. Unveiling the truth. What is an autopsy? An autopsy is a medical examination. It is done on a body after death. We call this a post-mortem examination. It's a detailed investigation inside the human body. We look for answers about how someone died. Autopsies are performed by specialized doctors. These doctors are called pathologists. They are experts in disease and injury. By examining organs and tissues, they find clues. These clues help us understand why someone passed away. The process involves a thorough examination of the body, both externally and internally. Pathologists use various tools and techniques to uncover the cause of death. They document their findings meticulously, ensuring every detail is recorded. This information can be crucial for legal cases, medical research, and understanding public health trends. Autopsies not only provide closure for families but also contribute to the broader medical knowledge. Through their work, pathologists play a vital role in the healthcare system. Why we look inside. The purpose of autopsies. Autopsies are done for many important reasons. They help solve crimes by finding hidden injuries. They identify poisons or drugs that weren't initially detected. Autopsies also protect families. They can uncover genetic diseases. This knowledge helps relatives make informed health choices. Autopsies ensure accurate death certificates, which is crucial for legal matters. The journey begins, step by step, through an autopsy. In this detailed walkthrough, we will explore the meticulous process of an autopsy, shedding light on each critical step. The autopsy starts with a careful external examination. This initial step is crucial as it helps us gather important information about the deceased. We note any visible injuries, scars, or tattoos. These markings can provide valuable clues about the person's medical history or cause of death. We then make an incision to open the chest and abdomen. This Y-shaped incision allows us to access the internal organs for further examination. Each organ is removed, weighed, and examined. This step helps us identify any abnormalities or signs of disease that may have contributed to the person's death. We take tissue samples for microscopic analysis. These samples are essential for detecting conditions that are not visible to the naked eye. This helps us see damage or disease at a cellular level. Microscopic analysis can reveal critical information about the person's health and the cause of death. The organs are then returned to the body, and the incisions are sewn closed. This final step ensures that the body is respectfully prepared for any subsequent arrangements. The guide in the labyrinth, the medical examiner. This professional plays a crucial role in the justice system and public health. The medical examiner is a key figure in an autopsy. They meticulously examine bodies to uncover the secrets hidden within. This doctor is appointed by the state. Their role is not just medical but also legal, bridging the gap between medicine and law. They are responsible for investigating sudden, unexpected, or violent deaths. Each case is a puzzle, and they are the detectives. They determine the cause and manner of death. This involves a thorough analysis of medical history, physical examination, and sometimes even toxicology reports. The cause of death is the specific injury or disease that led to death. It could be anything from a heart attack to a gunshot wound. The manner of death is categorized as natural, accidental, homicide, suicide, or undetermined. This classification helps in understanding the broader context of the death. Silent witnesses. Autopsies in crime solving. Autopsies are vital in solving crimes. They can reveal hidden wounds or traces of poison. They provide crucial evidence for investigations. For example, an autopsy might reveal a tiny fracture on a skull. This suggests a blow to the head, even if there's no visible bruise. This information can be the missing piece in a puzzle, leading to justice. Beyond the microscope, autopsies and medical advancement. Autopsies are not just about the deceased. They contribute significantly to medical research and education. By studying diseased organs, we gain insights into illnesses. Autopsies help us understand how diseases progress. This knowledge leads to better treatments and potential cures. They also play a crucial role in training future doctors by providing a real-life look inside the human body. The human element, respect and reverence in autopsy. While technical, an autopsy is performed with utmost respect. The deceased is someone's loved one. We approach each case with sensitivity and dignity. We remember that this is more than just a procedure. It's about providing answers, seeking justice, and advancing medical knowledge. It's about honoring the life that is passed and contributing to the well-being of the living. If you found this insight into the world of autopsies fascinating, please like, comment, and subscribe for more intriguing content on medical science and crime solving.